Obstructive sleep apnea (OSA) is a sleep disorder characterized by repeated interruptions in breathing during sleep due to the temporary blockage or narrowing of the upper airway. These pauses in breathing, called apneas, typically last for 10 to 30 seconds and can occur dozens or even hundreds of times during the night. OSA can lead to poor sleep quality, daytime fatigue, and an increased risk of various health problems, including cardiovascular disease and high blood pressure. Key information about obstructive sleep apnea (OSA). 1. Mechanism: OSA occurs when the muscles at the back of the throat relax excessively during sleep, causing the airway to become blocked or too narrow to allow sufficient airflow. When breathing stops, the brain briefly wakes the person to resume breathing, which may lead to gasping, snorting, or choking sounds. These awakenings are often so brief that people may not remember them, but they disrupt sleep and prevent reaching deeper, restorative stages. 2. Symptoms of OSA. The most common symptoms of OSA include loud snoring. This is often the first sign of OSA, noticed by a bed partner. Gasping or choking during sleep. Individuals with OSA often wake up briefly to restart breathing after an apnea event. Excessive daytime sleepiness, hypersomnia due to disrupted sleep. People with OSA may feel very tired or sleepy during the day. Morning headaches, caused by low oxygen levels during sleep. Dry mouth or sore throat upon waking, due to mouth breathing during the night. Difficulty concentrating. Fatigue and poor sleep can affect memory, attention, and cognitive function. Mood changes, irritability, depression, and anxiety are common in people with untreated OSA. In many cases, a bed partner may be more aware of the symptoms than the individual with OSA, as they may notice the snoring or choking sounds. 3. Risk factors for OSA. Several factors increase the likelihood of developing OSA. Excess weight. Obesity is the strongest risk factor for OSA. Fat deposits around the upper airway can obstruct breathing. Neck circumference. A thicker neck more than 17 inches in men or 16 inches in women can contribute to a narrow airway. Age. OSA is more common in middle-aged and older adults. Gender. Men are more likely to develop OSA than women, though the risk increases for women after menopause. Family history. The family history of OSA may increase the likelihood of developing the condition. Smoking and alcohol use. Smoking can increase inflammation and fluid retention in the upper airway, and alcohol relaxes the muscles in the throat, increasing the risk of airway obstruction. Nasal congestion. Chronic nasal obstruction, due to allergies or anatomical issues, can contribute to OSA. Medical conditions. Conditions like high blood pressure, type 2 diabetes, heart disease, and hypothyroidism are linked to a higher risk of OSA. 4. Health risks of untreated OSA. If left untreated, OSA can lead to serious health problems, including high blood pressure, hypertension. The repeated drops in oxygen levels during sleep trigger the release of stress hormones, which can raise blood pressure. Heart disease and stroke. OSA increases the risk of cardiovascular issues, including heart attack, arrhythmias, and stroke. Type 2 diabetes. OSA is associated with insulin resistance and an increased risk of developing diabetes. Obesity. OSA and obesity often coexist, creating a cycle in which weight gain worsens OSA and sleep disturbances contribute to difficulty losing weight. Daytime fatigue and accidents. Excessive sleepiness from OSA can lead to poor concentration, reduced work productivity, and a higher risk of accidents, especially motor vehicle accidents. Mental health issues. Chronic fatigue from poor sleep can lead to mood disorders like depression and anxiety. 5. Diagnosis of OSA. Diagnosis typically involves a combination of clinical assessment and sleep studies. Medical history and physical exam. The doctor will ask about symptoms like snoring, daytime sleepiness, and any observed apneas. They may also measure neck circumference and assess risk factors. polysomnography sleep study. This is the gold standard for diagnosing OSA. It is performed overnight in a sleep lab, where sensors monitor brain activity, eye movement, breathing, oxygen levels, and body movements during sleep. Home sleep apnea test. For some patients, a simplified version of a sleep study can be done at home using portable equipment to monitor breathing and oxygen levels. 6. Treatment of OSA. The primary goal of OSA treatment is to keep the airway open during sleep. Treatment options vary based on the severity of the condition and underlying causes. Lifestyle changes. Weight loss. Losing weight can significantly reduce the severity of OSA or even resolve it in some cases. Avoiding alcohol and sedatives. These substances relax the throat muscles, making airway obstruction more likely. Sleeping on your side. This position helps keep the airway open, as sleeping on the back can allow the tongue and soft tissues to block the airway. Regular exercise. In addition to promoting weight loss, exercise can improve sleep quality and overall health. Continuous positive airway pressure CPAP. CPAP therapy. This is the most common and effective treatment for OSA. A CPAP machine delivers air through a mask worn over the nose or mouth during sleep, keeping the airway open by maintaining positive pressure. CPAP improves sleep quality and reduces the risk of OSA-related complications. Oral appliances. For mild to moderate OSA, a custom-fitted oral device can reposition the jaw and tongue to keep the airway open during sleep. Surgery. Surgery may be an option if other treatments are ineffective. Surgical options include removing excess tissue from the throat, repositioning the jaw, or creating a permanent opening in the windpipe. Tracheostomy in severe cases. Uvulopalatopharyngoplasty UPPP. This surgery removes soft tissue from the throat to widen the airway. Genioglossus advancement and hyoid suspension are procedures that reposition muscles to prevent airway collapse. Nerve stimulation therapy. In some cases, the small device can be implanted to stimulate the hypoglossal nerve, which controls tongue movement, helping to keep the airway open. 7. Prevention of OSA. While not all cases of OSA can be prevented, certain lifestyle changes can reduce the risk. Maintain a healthy weight. Weight management is one of the most effective ways to prevent or reduce OSA severity. Exercise regularly. Physical activity promotes healthy weight and cardiovascular health. Limit alcohol and avoid sedatives. These substances can worsen airway obstruction during sleep. Quit smoking. Smoking increases inflammation and fluid retention in the airways, worsening OSA. Conclusion. Obstructive sleep apnea is a common but serious condition that can lead to significant health complications if untreated. Early diagnosis and appropriate treatment, including CPAP therapy, lifestyle changes, and in some cases, surgery, can help manage OSA effectively, improving both sleep quality and overall health. Reducing risk factors such as obesity and smoking also plays a critical role in prevention and treatment.